Hi, it's Dr. Elisha Van Dusen with New Hope Chiropractic. Did you realize that there may be a link between your hips and lower back pain? If you've been struggling with low back pain that just won't quit, it might be because the problem isn't coming from your back at all. More often than many people realize, hip dysfunction is the trigger behind chronic low back discomfort. Your hips and lower spine are part of the same mechanical chain, and when one part breaks down, the other part pays the price. So let's take a closer look at why this happens and how chiropractic care could help you recover. Your hips are the foundation of your spine. They support your body's weight and anchor the muscles that also attach to the back. But if the hip joints become stiff, weak, or misaligned, even slightly, your lower back picks up the slack. This compensation may not be real obvious at first, but over time it leads to imbalances, fatigue, and inflammation in your low back. Common hip issues that can contribute to back pain are things like restricted range of motion from arthritis, past injuries, or fatigue from the pressure that built up from prolonged sitting. Also, you might have pelvic misalignment due to muscle imbalances or uneven leg lengths. You might have tight muscles that flex your hips. This pulls your pelvis forward and puts more stress on your spine. You might have weak glutes and core muscles, and that fails to stabilize your movements. The imbalances force your back to move in ways it's not built to handle. That increases your risk of joint irritation, muscle spasms, and even disc problems. So how can chiropractic help restore this balance? Well, when patients come to us with low back pain, we don't just focus on the spine. We look at how your entire body's functioning together, how all the parts are functioning together, including the joints and muscles of the pelvic region. So people come in for issues like this. We evaluate the hip alignment and the range of motion. We check for leg length discrepancies, gait abnormalities. We look at spinal and pelvic areas that might be out of alignment and do adjustments on those to correct the joint misalignments. We use soft tissue techniques to release tension in the hip and gluteal muscles, tendons, and ligaments. And also we recommend special stretches and exercises that restore mobility and strength too. And the goal isn't just pain relief, but really correcting the dysfunction and the balance of the nervous system so the pain doesn't come back over and over again, because the pain is just a symptom. It's not the underlying cause. So here are some signs that your hips might be involved in your back pain. Pain is worse on one side of the low back than the other. You might have discomfort after long periods of sitting down, especially in the front of the hips. You might have trouble squatting, lunging, or climbing stairs. You might have a visible tilt in your hips, or even unequal wear on your shoes, tightness or pulling in the groin or the outer thigh area. All these symptoms suggest that your back pain might result from a mechanical problem in the hips or the pelvis, an alignment issue there. So don't let these hip imbalances keep you in pain. And if you're tired of chasing back pain without any kind of significant relief or results, it might be time to look at your body as a whole. And chiropractic does just that. It's a non-invasive approach to restoring proper function and looks at the underlying cause. So if you know anybody who's struggling with these types of issues, or it may be you yourself that are struggling with these issues, give us a call. Check us out at newhopechiropractic.com, or give us a call at 714-556-6966, and we'll be happy to check it out for you and see if we can help and see what's truly involved with your low back pain. And with that, have a healthy day.